I was quite bad for 8 days.
Okay. And also, you can, if you are interested, whatever I do, I am having a webinar seminar on the day after. If you're interested, you can always join in. Choice is yours. Yeah, but it's going to be a good seminar, which I've been doing for last 8-10 years. So let's begin. I'll just put up my okay. So this is the secret of healing any disease. So I have been having a lot of questions about healing any disease. Yeah. Now I want to really tell people that it's a secret to healing any disease. And anything that is to be, if you want to get healed or you want to change yourself, you want to transform yourself, remember there's an application. And then when you start applying that or implementing that for a longer period till the time it is required, then you definitely have changes. It's almost like you wanting to make money. So there are secrets to make money, but definitely the work is supposed to be done by you. Right? So many people think, okay, the secret is out, and why people are not getting okay? Because we know that we have the potential of our mind and we can achieve anything. It's been told for centuries, but how many of us actually use this principle? That's the key. That it's all available to us. People call it miracles. I say, no, it's not even a miracle because it's natural. It is natural that we should be healed. But how many of us really apply ourselves? Yeah, so that's what it is. So this is about me. Yeah, I'm a homeopathic physician for last 25 years, practicing as a new life educator, an integrative wellness facilitator, a counselor and a health psychologist, and a relationship wellness counselor. So what I'm doing, why integrative wellness? Because I bring in a lot of various modalities. I bring in a lot of modalities that are put together in order to bring about a transformation in any area of life that is chosen, or a client or any person comes to. So that is where the integrative wellness thing, and that is what I tell people also, that if you want to become a good therapist, you want to become a good therapist, then it's important for you that you start practicing integrative wellness rather than one particular mode. It's very important that you practice integrative wellness, because what I have noticed in my practice for last so many years, I've been practicing as a therapist, as a counselor for last at least 15 years minimum. What I have seen is that one mode of any kind of therapy or practice is not enough. So you can be a yoga practitioner, great, and yoga completely, like, it's a well-rounded approach to great, good healing work or good healthy life. But at the same time, there are times when you require not just the yoga, but something more you might require. Like, you got to bring about your thoughts in place, and you got to do something more than that. So I train people in Tai Chi, I train people in the way of thinking, I train people in how do you heal yourself, how do you connect to your body, and all those things put together. How do you heal yourself holistically? That's an approach. Yeah. And when you start utilizing this approach, I've seen that it becomes easier for people to bring about a change in themselves. Right? And now going to, and so these are the various kind of therapies that I train people in, I teach people. One is core somatic integration and accelerated cures, because the kind of therapies that are being used has helped people to bring about a shift in themselves in a very short period. Like I am going to talk to you about the anxiety disorders, that people have come with anxiety and panic attacks. And after having gone through severe panic attacks for 2 years, we have just done 45 minutes of work. And in that 45 minutes of work, that person, I spoke to her after 6 to 8 months, and she said, I have never ever got the panic attack, which was almost all the time or every day. And when she came to me, when she was there on the Zoom call, she was trembling with fear and the panic. She was continuously trembling, and she just within 45 minutes, the whole trembling went off. And she also changed so much that she's saying, I'm much calm and relaxed. And her husband also, who had introduced her to me, said that she's completely okay. So that's why it is called accelerated cure. And of course, moving stillness is mindfulness in movement. That is about the Tai Chi and Qigong exercises, which I have been teaching people for almost 10-12 years on and off. And I've been practicing myself for last 22 years. And today we have completed one 8-day program. But the news is that I am starting with the Tai Chi and Qigong classes every Saturday starting February 5th. So people who are interested, that is in the morning, 7 to 8 a.m. on Saturdays. So people who are interested can message me on the WhatsApp group that you are there. Yeah, or you can message me or call me on 98. You can write down the number 98208 00120. 98208 00120. Yeah, I'm putting down the number on the chat just in case people who are interested, they can join in. So, and of course, I teach clinical hypnotherapy, past life regression therapy. I am also a trainer of transactional analysis, neuro-linguistic programming, creative visualization. So basically, what I'm trying to say is that it's an all-rounded approach which I am talking about and which I practice and which I teach. Yeah. So this is very, very important. And of course, for people who are counselors, therapists, doctors, psychologists, I recommend this highly, that take up this kind of therapy even when you are practicing your own stuff. It is very, very helpful for people. And there are rapid cures, rapid changes that happen in people's lives when you understand this and start practicing it. So we are doing whatever we are doing, but at the same time, we are integrating all these approaches. So these are some of the programs. So I've done at least 250 workshops and at least 700 free webinars and seminars, trained more than 1,000 individuals across the globe for applying these therapies, and trained more than 17,500 individuals in various formats, and conducted training for at least 2,500 corporate professionals and lots of students, yeah, psychologists and all. So now we are moving into the secret of healing any disease, an introductory webinar. Remember, this is an introduction we are talking about. Here, I will not be able to treat or heal anyone on this because it can take any amount of time. It can take 5 minutes, it can take 50 minutes. So I cannot control the time period. So that's why I would request you that we will not talk about healing someone and those kind of questions. You can always ask me, or you can send me on my WhatsApp. I will definitely respond to them, but I will not be able to do any kind of treatment or healing in this next 1.5 hours. Okay, so what we are going to learn over here is 6 steps technique to heal any disease. How do you initiate cellular healing in minutes? And the 4 steps to reverse programming to natural immunity and health. And how do you prevent incurable diseases? And here we are talking about a scientific, rapid, and effective therapeutic modality. So in different webinars, I keep talking about the variety of things that I'm put over here. In different webinars, I talk a little about this. I talk a little about that. When we are talking about beating anxiety, then I talk about how do we deal with anxiety and how this actually works. And here we are talking about something different, slightly different, so that in different webinars, it is all covered up. So I request you to attend the various webinars. These are all free webinars. Yeah. So I request you to please come in and attend the various programs. And people have said that it has benefited them quite a bit. So this is the workshop I'm talking about, core somatic integration therapy, which is a body-centered integrative psychotherapy workshop, which is happening on 22nd and 23rd of January, 3 to 8 p.m. This is a 2-day workshop. I'll be talking a bit about that very soon. Yeah. So let's understand this. What's a disease? Role of trauma in disease creation, and what is the secret to heal any disease? So let's talk about this, friends. What is a disease? Please put on the chat what comes to your mind when you say, what is a disease? Or you can just shout out, what is a disease?
What makes you feel uncomfortable, unbearable?
What is unbearable? What makes you feel uncomfortable? What is unbearable?
Body is not in ease.
What is not in ease? Yeah, that's like a standard definition that we are given. Yeah, very good. Who else? Keep shouting out, 1 or 2 people. You cannot be wrong, first of all. So just go ahead. Disease, not at ease. Priti, Mayuri, pain, discomfort. Very good. And disorder of function. Anu, that's good. That's good. Something that has been manifested by the mind. Butaina. Yes. Yeah, but what is that? Everything is manifested by the mind. Butaina. What you are, what I am, the things around us, everything is manifested. What is a disease?
It gets your attention to your own body.
It takes your attention to your own body. Yes.
In form of pain, being uncomfortable,
Right.
various things.
Brilliant. Yeah. So we are talking about disease. Now let's understand what is the role of trauma in disease creation and what is the secret to heal any disease. And this is something that we really got to understand, because till the time you don't understand trauma and deal with trauma, you're not dealing with the root cause of the disease. Now, one of the reasons that medicines don't work, or they work very partial, or they work very temporarily, because those medicines which are being given are not tapping into the root cause of the problem. And that is why you will see, you start off with medications, and then today you're taking 1, tomorrow you're taking 2, and the day after you're taking 3. It goes on increasing, or something starts as a small ailment and slowly it grows and the organs get involved and you keep suffering and you're taking more and more medicine. Why does this happen? That over a period of time you have to continue taking the medicines, or you have to increase the number of medicines, yeah, or the quantity of medicines. The only reason is that simple, that you have not dealt with the real root cause of the problem. As simple as that. Like, it's like there is this water overflowing and you're just trying to cover it with something so that it doesn't overflow. Now the pressure is too much, and now you will require to add on some more weight on it to make sure that the water doesn't flow, and then the pressure is increasing because you're trying to suppress it, and now it's pushing further. You add more weight. So that's exactly, the weight is nothing else but the medicines that are being taken. So the more you're trying to suppress it, the more it pushes outwards, and the more pressure is required. That is the medicine. So in fact, you are not treating the root cause. So we have to start getting this very loud and clear, that when are we going to pay attention to ourselves? When are we going to pay attention to ourselves such that we heal ourselves completely and live a healthy, happy, joyful, empowering life? So that is very, very important for us to know. Yeah, rather than playing victims, rather than playing slaves to these medicines. Now, to understand, I'm going to talk in brief. Yeah, very, very brief, because the bigger things I've talked in the workshops, or when we have in other, say, webinars and all, where I talk a little more. So I cannot complete everything in 1 hour, 15 minutes, but whatever I can. Yeah. So what is the secret to heal any disease? That is very, very important. Now let's take it one step one. How long does a human being live on an average? So on an average, 60 to 80 years. It used to be said that earlier it was different and more and low, but then 60 to 80 years on average, and even more. How does that happen? Because we have a system that heals us. That is called the healing system or the immunity system. Now, we are continuously exposed to the circumstances in the environment, which is always challenging for us. But at the same time, the healing system, the immunity system is such that it balances us in a way that we are able to be alive and also be healthy. Yeah, and but at the same time, we got to take care of this healing system. Now, remember, this healing system is innate. It's born, we all have it. We are born with that. It's autonomous, it's automatic, and it's always in integrity. Yeah, it throughout, and it is working towards restoring order and balance to help you reclaim your natural state of health at all times. It's always coming back like a pendulum. It's always trying to come back to the center. Yeah, it always trying to maintain equilibrium. And if you can help the healing system, it becomes much more effective and it becomes much more rapid. Most of our lifestyle, most of our attitudes are almost going against our own healing system. And that's one of the reasons we are unhealthy, we are sick, we are struggling. So it's very, very important that we start paying attention to our healing system. I tell people that look at this way, look at it this way, that the healing system, the body is always trying to work for you. Even when you are awake or you are sleeping, doesn't matter what kind of food you eat, how much you drink, you abuse your body. Yeah, you take stuff, you do substance abuses, you watch so much of, indulge in so much of TV programs, not sleep properly. You're continuously giving a lot of negative information. You maintain, hold on to negativity, you hold on to anger, resentment, hatred, jealousy, but at the same, which is not healthy. But at the same time, the body and the mind is working in a way such that you come back to equilibrium. You're always in the state of health and balance and alive for the longest period of time. And even if at all it is giving you a disease, it's giving you in a particular area which can be handled if managed well, or you make the lifestyle disease, but we ignore it, and then we fall sick further. So it's time that we start paying attention to what the body is trying to tell us. It is time that we pay attention to what the body is trying to convey to us. What is it, the message it is giving us, rather than ignoring it. If you start paying attention, you are going to heal. Remember, there are two things that is very, very important. One is paying attention. Second is having an intention to heal. These are the two main things that are required. Paying attention and having the intention to heal. These are the two main things that are required for healing. Why we are suffering? Because one thing, we don't have the intention to heal. You might say, but I have it, but your actions are not in sync with that. Secondly, when the body is giving you a message, you are not paying attention. Like the body is giving you a message, boom, 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 I'm getting my palpitation. Though you just take some medicine and you go off to sleep so that I don't feel the palpitation. It's giving you a headache. You take a crocin or you take a painkiller, you go off to sleep. And but it's trying to say something, dear. Why don't you listen to it? So are we together on this? So let's move ahead. So we all know this. We know about our own body. Right from childhood, we have got cuts, wounds, or some kind of fractures or whatever, or some abrasions. We are talking about something that can be seen. But at the same time, if you allow it to be there for some time, or just take proper precautions by washing it or doing putty and all that, over a period of time, you'll say 3 days, 4 days, 7 days, 14 days. It just heals itself. Even when it is broken, the joints are broken. The doctor just puts it together, but the healing happens on its own. The doctor just puts the fracture together so that there's no malunion. It just comes back in position, and that's how you heal itself. You allow it to heal itself. So that is very, very important to know, that you know that the body can heal itself, but we behave or we believe as if the body can't heal itself. And we are not even willing to give it time. Why? Because we are so scared. And secondly, we are not educated in it. And the system doesn't want you to get educated in that. As simple as that. Because if you get educated, you will start taking care of your health. You will start healing yourself. And that's not good. That's not at all good for the system or the pharmaceutical industry. That's not at all good. So we have to start taking care of health, because they come up with this, okay, you have vitamin D less. You definitely need those vitamin tablets. I'm not saying no, but you're not told that just go out there and sit in the sun and allow yourself in the morning, that will help you. Or what are the kind of medicines, or what are the kind of vegetables or food that you're supposed to eat. Not many of them are telling us this. The direct thing is go and take medicines. Well, that's not good, because you are not paying attention to what the body is requiring. It's like there's a leak of the pipe from the wall. So instead of looking at the leak from the pipe, from the wall, you are just plastering it on top. It's going to still leak, and it's going to weaken the foundation or the wall of the house. So it's important that start paying attention, go inside, figure out what's happening, and clear up the leak, or change that pipe, or do whatever. It will be helpful. So something of that sort, we have to start looking at it first. So there was this doctor. So each of us have this extraordinary gift, the body that knows how to heal itself. Now remember, I am saying a body that knows how to heal itself. Right? So there was this doctor I read it in one of the books, Dr. Brownstein, who talks about his client. Yeah, and the patient's rib was removed to access his lungs for some disease, and one of the ribs was removed. But he saw that the person had come with the X-ray, the old X-ray, and then came up with the new X-ray 25 years later, and that rib that was removed, though it was not the way the healthy rib would be, but in a deformed way, it had grown on its own. And it is also that some animals have a capacity to regrow, like salamanders, lizards. And so he was surprised, and he said, if a rib can grow, then any organ can grow. That means the body has the capacity to regenerate all this. Only thing, we have to wait and be patient enough, or we can focus. And there are so many instances. When you're talking about Greg Braden, he's also talking about it. You talk about all these people who are there. You're talking about Dr. Brown. He's also talking about it. So there are so many of them who are talking about, even in the Western world, of the inherent power that the body has to heal itself, to regenerate itself, to rejuvenate itself. But there are ways to do it, and that is what I call as the secret. Yeah. And in my own way, I have figured out certain things which is helping people a lot. Okay, so at this point, I want you to just close your eyes, focus on your breath. Just close your eyes, focus on your breath, and just observe your self for a moment. Pay attention to your breath. We are doing it very short, but I just want you to pay attention to your breath. And just notice the breath. What's the sensation of your breath at your nostrils? And also notice in various body parts, what are you feeling? Like for right now, I can feel that I have some stiffness in my spine, mid-spine. And also I have some tightness in my right hip and some tingling in my feet, my hands, some tingling in my left hand, in my right hand, and I can feel salivation. And my head is heavy. And I also noticed that there were 2-3 burps. And I can feel energy, heat in my face. So these are sensations. So just write down on the chat, breathe in deep and breathe out. Write down on the chat, what are the sensations that you're feeling? Open your eyes, write down what are the sensations you're feeling, whether it's good, not good. These are sensations. It's not about good and bad sensations. Remember, they're just sensations. So what are the sensations you're feeling? Just put it on the group chat. Yeah, pain in the left ear, left ankle pain, slight headache, low back pain, low back tightness. Very good, Janet. Mayuri, very good. Shamla, yes, left ear. Heaviness in shoulders, forehead congestion. Very good. Yeah, sensations behind left ear, Janet, very good. Not painful, but noticeable. That's very good, Janet. It is not painful, but it's noticeable. That's exactly what we have to start paying attention to. Even the smallest thing we start paying attention to, that itself will start healing. Very good, Janet. Heavy head and hammering in ears, Anita, brilliant. Soles are heavy, calves are tight, solar plexus, Niba, very good. Feeling sleepy, very good. Sensation in shoulders, Kiran. Upper back pain, Gyandev, yes. Okay, so just keep adding, okay? So that's quite good, yeah? So many of them, if you notice what happened, but when you're listening to the talk, were you aware of this? You might have been aware, you might be getting this on and off, but the thing is that how many of us pay attention to all this on a regular basis or all the time? We don't pay attention, and over a period of time, this becomes disease. And now it is only trying to tell you something. We are not listening to it, right? So what is a disease? A disease is, as we have spoken, people have said that disease is nothing else but dis-ease, means going away from ease. Now, remember, disease doesn't mean going away from ease is not just when it becomes an actual disease. No, even how I put it is that even you are feeling uncomfortable, like whatever sensations you wrote about, and you felt that there's a heaviness in my head, or I feel that there's a slight stiffness in my shoulder, or I feel that my upper body is tight or heavy, that all I will consider as a beginning of a disease or a disease, because it's putting me out of my comfort zone. But if it's putting you out of the comfort zone, then it is actually wanting you to go back into your comfort zone. But how do you do that? You do that by paying attention to it. Once you pay attention, the body can move itself into health. Remember, it is almost like that small child. The child is crying, screaming away. Small child screaming away, crying. Now, you ignore the child. What does the child do? The child screams further. And then you might get angry. You might slap the child. Suppose. Now, two things can happen to the child. The child will scream further, or the child might become quiet. Now, if the child screams further, that is not helping the child to learn how it should express itself in order to achieve something or get something. So it continues, and later on, the same child becomes violent, aggressive, or it can go on to the other side where the child can suppress, not to cry. But what happens at a later point? The child becomes inconfident, wants to express but cannot express, wants to ask but cannot ask. And that itself can be a disease, because that can lead to develop into relationship problems, or developing anxiety and fear whenever there's a need to ask or say something. And that is exactly what's happening over here. So, Riti, whatever questions you have, please, again, I would request, put it again in the end, yeah, because I will answer all these questions. That's a good question. I'll answer all this again. But put it again, whatever questions you have, you can put it now, but also put it again towards the end. Yeah, I would like to answer those questions. So now, what is that disease? Now, remember, I see it very simple. There are two processes we are talking about. One is called the regeneration process and degeneration process. I'm quite sure this word might make a lot of sense to everyone, whether you know science or you don't know science. We are all going through a regeneration process and a degeneration process all the time. Not just we ourselves in our body, but otherwise also. You look at your own house. You build a new house. Everything is looking so clean and nice and well painted and everything looking spick and span. And in matter of 10 days, 6 months, 1 year, you start seeing that the wall is chipping off. There are certain paint chipping off, or it's looking older, or there is there are marks on the bathroom floor, or the tiles start cracking, or there is something happening to the furniture, right? So nothing else, but initially it was good, and then it starts degenerating, and then it gets to a particular level. What we do is that we scrape it off and we start reworking on it, revamping it, and then it's back to looking as if new. And then again, after 2-3 years, again you have to repaint it. Exactly the same way our body is responding. Our body is responding. Now, our body is always regenerating and degenerating. Right now also, whether we know it or don't know it, our skin is flaking and it's throwing away a lot of skin flakes, which we are not able to see. Are you getting it? We are not able to see. The hair is changing or breaking off and all that. Most of the people know when they wake up, you have few strands of hair here and there. So it is always degenerating. But at the same time, that doesn't mean that you are losing your hair in next 5 years or 10 years, you become bald. No, it doesn't happen. Even after at the age of 80, you still have your hair intact, if not all, but many of them. So what happens? There is degeneration happening, there is throwing away happening, there is breaking off happening, but at the same time, the regeneration is also happening. Remember, this is the balance between the degeneration and regeneration. But if the degeneration is more, than the regeneration, that is the breaking of the walls or the chipping of the paint is more than what you are supposed to do for it, then it will look shabby, or there will be cracks, or it will degenerate further. Yeah, something will go wrong with that wall or the building. Same way, when the degeneration is more than the regeneration, it leads to disease. But if at all, the regeneration, which is what is happening most of the times, the regeneration and the degeneration are at the equal level, or the regeneration is more is being produced. Healing mechanisms are very healthy and they're working effectively. Degeneration is definitely happening, but you will remain healthy. That is why people who are eating well, having a healthy lifestyle, or people who are exercising, doing the breathing exercises, yoga, you've seen them, they are 60, 70, 80. And you'll say, I don't know what's happening, but this person seems to be looking young only all the time. How does that happen? Because they are maintaining the regeneration capacity. That's why all these holistic sciences like pranayam, like yoga, like tai chi, various other martial arts or meditative practices, this all stay in vogue. They never go out of vogue because these are all holistic practices and they're going to stay. It doesn't matter if it's been 5,000 years or 10,000 years, it's going to stay like the stars and the moon and the sun in the sky, because they are healing you all the time. But get that, if your healing mechanisms are working well, then there's a problem for some systems, some pharmaceutical industry out there, and they want you to get onto processed foods and all those things. So you are the one who's supposed to take responsibility of your health. You got to be willing. You got to be committed to your health per se if you want to remain healthy and enhance your healing mechanism. Right? You cannot be allowing something else to take over. Are you getting me? You cannot be casual about it. And it's like taking care of your child. It's your child, you'll definitely take care. And your body is your child. You cannot neglect it. Right? It's your child, you cannot neglect it. And you should not neglect it. So I hope this is clear. Now, let's understand trauma. This is the key. When we are talking about tapping into the root cause. So get that everyone on this planet has gone through some trauma or the other. When we are talking about trauma, we are not talking about the small things like what we talk on day-to-day basis. Oh, I got traumatized. I didn't find the cab on time. Oh, I didn't reach for the movie theater on time. That's not traumatic, by the way. Traumatic is when there is a crisis, when you feel, the subconscious feels that your survival is in danger. Okay, and it can be different for different people, and it can be different at different times. For a small child, like not seeing the mother when it's hungry, like a newborn child, not the mother not coming in for next 5 minutes, might be traumatic. But for a person like you and me, we may not find a hotel, or we don't get food for 1 hour or 2 hours or 3 hours. We can still do our work and we'll say, oh, it will happen, because our rational mind is working differently. So what can be traumatic for someone may not be traumatic for another. What can be traumatic for the small child may not be, is definitely not traumatic for a big person. Are you getting me? So a small child of 3 years, 4 years getting beaten up even once can become traumatized or being abused. But a person who's grown up, if something goes wrong, they can rationalize, or they can work it out much better than a small child, or they can push themselves out of that. So get that, for different people, it's different. So that's why don't negate what a child feels, and don't negate if someone is talking about that this happened to me in childhood and I felt horrible and I just don't know how to get out of it. Don't put it as, oh, that happened in childhood 15 years back, 20 years back, now you should forget it. No, the person may not talk about it, but the body remembers. And remember, the body remembers everything. The body remembers everything. It will memorize everything. Yeah, you cannot say no, it should not happen. So whenever there is crisis, the body reacts in 3 fashions. Now this is stress. Let's talk about a big dog approaching you. If you're scared of dog or any animal or in danger, there are 3 ways. Like suddenly a car comes towards you and you don't look. So there can be 3 ways. Either you will stand and scream, hey, what are you doing? Or you just jump off, or you just stand there paralyzed. So this is fight, flight, and freeze. Fight and flight is okay. Like whenever you can fight it back, or you can fight it or flight, you can run away, you're still managing to have a healthy healing mechanism. You come back to health easily than if you're frozen. Frozen means the child is being screamed or beaten up. When the child goes, I cannot, it's a very helpless situation for the child. Yeah, it's a very helpless situation for the child. Now, that is the time when the child is frozen. Right? It is frozen, and it all happens to us. Now, what happens at a later point is just a repetition of whatever happened as childhood. But since you have not worked it out, it keeps repeating itself, and keeps putting you in that same similar kind of situation till the time you don't work it out. For example, you had a problem in childhood, suppose, and in childhood, in relationship with your mother or father, or your brother or sister, there is some anger, or there's sadness, or there's hurt, there is resentment, it could be anything. Now you grow up, you get into a relationship, the similar kind of feelings will come in this new relationship very soon, or post marriage. Though initially the relationship might look good, but after some time it starts degenerating. And that's why people say, oh, this person before marriage was showing up as a very nice person, suddenly this person has changed. No, the person has not changed. The old behaviors have come up. And same thing with you also. Your old behaviors also come up. Now those two old behaviors are not matching. And that's why there is degeneration, there's breakdown in a marriage relationship or healthy relationships. And then leading to whatever breakdowns or divorces or whatever. Now remember, you don't need to go in for a divorce because it's not working. You got to heal it. It's an opportunity that the body is coming up with all the discomfort that you're feeling in relationship with someone. It is not because of the person. It's only your old patterns are coming up. And the old patterns will always want to win or take its place or reclaim its place. If you're trying to change it, it's not going to happen. Now, if you're not healing them, it will only escalate, like the way the breakdowns in the marriage happens or in the relationship happens. Same way it happens in a disease. It will only escalate, it will grow up, it will want your attention more and more. But instead of working and healing it, you say, let me get it out. And you break down a relationship. Or it's the same way that it comes up as disease. So instead of trying to figure out where it started, you cut it off. Or you push it down. Or you are every day taking some sleeping tablets. Or you're taking alcohol. Or you're continuously trying to do away with it. Or you're trying to ignore it. Doesn't work. The body, the subconscious is way more powerful, and it will keep showing up as a bigger disease, much more bigger. So now get that if you're suffering for a long time and you have not healed, and if your disease is growing more and more, then it's time that you look into what's really happening. Okay, let's move ahead. Now remember, you're trying to heal, like people, they're trying to push down the thoughts by taking medicines and all, sleeping tablets and all. Remember, all this trauma is a somatic experience, it's a bodily experience. So it has to be healed at the somatic level. That's why simply counseling and talking about it to your friends or families may not help. Now, trauma, when it is unhealed, that is, it remains under stress and disease will happen. And in trauma, energy contracts and disease will happen. When you start healing, the energy expands and you are in health. Now remember, in order to be healthy, your energy needs to expand. It's like when you're happy, how does it feel? You feel very expanded. You're more joyful, right? But when you're sick, you contract. Yeah. So that's exactly what happens. So many kind of diseases, like I'm talking about someone who come sometime back. She was also there on the webinar. She's a nutritionist. And she was suffering of a heart disease. And the doctors had said that maybe in the next few months, we have to operate on this ailment. And we'll meet again. In the meantime, she had called me. I was very new to this work. I just discovered how to do this work that is called core somatic integration. And she said, Rajiv, I cannot move. Can you come down to my place? Because I have a problem. And she had small daughters, 2 small daughters at that time. And I still remember going there somewhere in Mahim and Mahim Motunga. And then she started talking about it with the core somatic, just the way we did just now, observing what's happening and all that. And she could feel so much of energy moving and a lot of sensation, discomforting sensation. Then we go into memories and experiences. We figure out all those things and then we start healing it. Yeah, and 1 hour we did one day, and the second time again, and maybe 2 or 3 times we did it. And then she met the doctor, and the doctor saying, I don't know what's happening, but I can't find the symptom. Like, what do we do surgery on? And then she came on the webinar just after 4-5 years, just 2-3 months back, and she says, Rajiv, every year I am going to the doctors. And the doctors are saying, we don't know what's happened, but whatever we were going to operate on, that symptom is not there now. But we are sure it will come one day and then we'll operate. And this girl laughs and she says, how will it come? Because I have healed it. It's not possible. But let the doctors keep what they think, and I will be maintaining this. And she's doing very well. Her children are grown. I just saw a snap also, and she's quite healthy. So that is how it is. So we are talking about some things that need surgery also can be healed simply. So you're actually saving a lot of money over here. So on my own story, I was quite low and out, severe anxiety, depression, irritable bowel syndrome, and severe body pains for a long time. And that is where this whole thing started working for me, where I would observe what's happening, because I didn't know what else to do. I would wake up at night, keep crying for 2 hours because I didn't know what to do. And it was completely a hollow story for me in my body, feeling very low and out. And every day, 2:30 to 4:30, I would be awake and keep crying because it was so painful and so depressing. And this went on for a good long time of 2-3 years, even after that. But the thing is, then I started noticing that when I started noticing my body and observing what's happening, after 1 or 2 hours, I would feel very healed. And that is where this whole understanding about that, if you look at the body properly and pay attention to it, the healing capacity of the body will show up itself. And this all started off when I was doing my Tai Chi. Tai Chi is a soft martial art exercises I was learning from my teacher in Lokhandwala. And he had told, it's easier to go from the body to the mind than from the mind to the body. And that stuck in my mind. I said, what does this mean? And I didn't know that it's going to be a way of life, or a way of life which I'm teaching hundreds and thousands of people across the planet. But that one statement from my teacher, from my guru, has completely changed my life. Even today, I told the story to my students in Tai Chi. So this is how it is. Remember, the natural state of the body is health. It's just going fast. Diseases are a way to warn you that you have strayed from the path of healthy living at some level, emotional, mental, physical, or spiritual. Means you have moved away. And it is indicating to return to the path of healthy balance. Whatever we spoke. It's only telling you come back. वो बोलते हैं ना कि सुबह का भूला हुआ शाम को घर आ जाए तो भूला नहीं कहते. वैसे it's only telling you come back. You have strayed from the path. आप अपना रास्ता भूल गए हो. You just come back. That is what it's trying to say. So we all need to just come back. Core somatic integration therapy is a body-centered therapy. What do you mean by what I said earlier? It's easier to go from the body to the mind than from the mind to the body. Here we are connecting to the body and directly going. Why? Why is it so effective? Why is it so effective with the body-centered therapy? Simply because what we call as the subconscious is nothing else but your body. But we keep going, it's like the mind, where we are not aware of this. The body is talking on its own. It's trying to tell you something. Just pay attention to it. The subconscious will talk to you. And that's why we are directly in connection with the subconscious. And that's why it is one of the most effective therapies. And I have got cases which are like rapid as magic. Even doctors have gone through it. And they're saying it cannot happen so fast. Like I was just treating someone who had irritable bowel syndrome and had some issues with, I think, piles or fissures or whatever, and severe anxiety. And we did the work, and the next day she comes in, 2 days later she comes in, or 3 days later, and she says, Rajiv, ye ho nahi sakta hai. I am experiencing all this. You did the work, and the next day in the afternoon, it's not there. It has never ever happened, and it cannot happen even with all the medicines, including allopathic. Ye nahi hua hai aaj tak. So how can it happen in few hours? And that is the kind of rapidity it works with. Many cases, I'm not saying all, but many cases. And what I just told you, what makes core somatic integration so effective? As point of view of healing, move from, so that what is important over here? See, remember, we know that we have learned about it. There's something called Newton, someone called Newton. Yeah, and we know about his laws, the 3 laws. And one of the laws says action and reaction are equal and opposite. Yeah, but when we say Newton's law, we are saying action from outside, and then there's a reaction from inside. So you're talking about a stimulus and something happening from outside, from inside. And that is what we are talking about. Something happens and we are reacting to it. So this is Newton's law. But we are moving from Newtonian law to Einsteinian law. What is Newtonian law? It is simple, saying that action and reaction are equal and opposite. So something happened, and that's what generally happens. It's a blame game. And that's what, if you go to a doctor, they will ask you, what happened? Did you go out in the rain? Did you eat something outside? What, did you have a fight? Are you worrying too much? Are you too tense? That means there's something outside that is impacting you. You're not a problem. But that's where it's going wrong. Are you getting me? Your bone has a problem. That's why you're suffering. No, you're suffering. That's why your bone has a problem. You're suffering. That's why your stomach is you are having irritable bowels, you are suffering, that's why you have a migraine. Not that you have a migraine, you are suffering. No, you're already having a disease which is showing up as a migraine. That has to shift. And that is what is the Einsteinian point of view, which says, what is it that you are doing to bring about the disease? Not as a blame, but what is your contribution? How are you thinking? How are you feeling? How are you behaving? How are you experiencing? What is happening in your body? What is the way what are you holding on to? What is the traumatic experience within you? How are you reacting to the situation or the disease? If you change your reaction, you will change the response to it, and slowly you will start changing the thought, feeling, emotion, and all that, and thus you'll change the disease also. I hope this is getting clearer. Heal yourself and heal the disease. And I can talk to you more and more about a lot of cases. Now, remember one thing, this is my favorite line. The body is seldom lacking the ability to heal. What is lacking in is the person's ability to interact with the body, to communicate with the body such that it will heal. So we have to look at our interaction with our body. That is exactly the exercise that we did in the beginning. You started noticing what's happening, and that is the interaction we got to have. And when you are healthy, you will start noticing good feelings also. This is the skill that you learn when you learn to practices that I'm sharing. Now remember, the body can rewire itself all the time with new experiences, and that's called neuroplasticity. So as I said, this therapy is not just some holistic kind of therapy we are talking about, and like people say it's a mumbo jumbo. No, it's a very scientific therapy. Yeah, and it is backed by scientific experiences. Yeah. Okay. Now remember one thing, this is a beautiful statement. We are unconscious creators of the disease. We start to heal when we start making the unconscious conscious. What is in the unconscious? The emotions and the memories. The unconscious expresses in the form of symbols, images, and sensations. And that's what we start to connect to. We start to heal. We start to connect to, and that is what we start to heal. And when we are able to heal that, which also expresses itself in the form of a dream, if we are able to heal that, because everything is a perception, you will start seeing that the healing capacities grow, and very soon you will not be experiencing that. Not only that, it moves so rapidly that things that you are wanting in your work, that you're wanting in your relationship, you will start seeing a rapid change. I have people who have been struggling with their relationships or with their work for 6 years, 10 years, 20 years. But after the work was done, within 3 months or 4 months, they could see a big shift happening in their business. They were able to focus on what I need to do in my career as youngsters and all that. Initially, they come in, oh, we are into drugs and substance abuse. And after a few sessions, they say, oh, I want to take up a career. And there are so many of them who have given substance abuse. So this is like a big one I'm talking about. Yeah. Okay. We have done this exercise. We can do it once more. Now remember, what you require over here is your willingness. As I said, the WRC, the responsibility and the commitment. And also what you require is action. Yeah. So here is the time to act. And I'm talking about some of the, I already talked to you about Mrs. Umale, the anxiety with panic attacks, severe pain in Swati for 3 years. She said, I practiced yoga and I've done many other physiotherapy and everything. But we took almost 30 to 40 minutes in the workshop where she said, my pain is gone. And I spoke to her again after 6, 7 months. We have done only once. And 6, 7 months. And she says, it's never come back. There's this another lady, Sonia, who's got ankylosing spondylitis. And when she came on the Zoom call, she said, Rajiv, in the morning, I was actually holding the walls to walk. I could not. It was so painful. And she wanted to cancel the appointment. But at 3 o'clock, she came in for the appointment. And at 4:30, she's saying, Rajiv, I just don't feel any pain at all. Yeah, and she's much better. She's saying my relationship with my husband, my child, everything has changed. And Shahnaaz from South Africa, she had this severe acute tennis elbow again in a workshop, severe pain. And by the time we completed, she says, Rajiv, it is 90% better. In the next day in the morning when she came for the workshop, she says it's 100% better. I don't have the pain. She's going through a bad time. And Nakia, who's again a psychologist, having PCOD and wasn't even interested in a relationship. She was, and after we did the work, she said, Raju, I am just getting interested in a relationship. She got married to that person. Yeah, it was arranged marriage. And then they say PCOD, you have problems with pregnancy and all that. She's got twins. The twins are almost 7-8 years. So like that, there are so many cases, endometriosis, leukemia, and all that. So there are so many cases that are there. Yeah. So the body heals itself. Remember, we got to connect to the body in a way that it heals itself. Okay, and these are the steps we are talking about. Now, this is what you learn in the workshop. All that we seek, divinity inspires. Now, we are learning how to acknowledge, how to track the sensations, how to track what's happening in the body, how to track the traumatic experience, how to witness that what I call as, I've given it my own term called witness sensing. And how do you support and move? There are certain supports that are given, or there are various movements by which the discharge starts happening, and then you integrate the positive experiences. Yeah. So I will just take you through one short exercise. I cannot complete it, but whatever we have done, we are doing it again. Yeah. Integrative body-centered therapy, and you're tapping into the innate healing potential of the releasing the stress and the traumatic experience. Remember, when you release stress, you start getting healed. It's very important that you release stress, because the nervous system, when it is stressed, it starts expressing itself in the form of disease. I told you, it's not just some holistic thinking or I don't know how, but it happened as a miracle. No, it's scientific how it goes, and it's following how the body heals itself, following the immune system and all that. Yeah, or the neuroplasticity and the neuro adaptability principles. Some of the diseases where it has been showing phenomenal cures are migraines, headaches, back pains, ankylosing spondylitis, gastroesophageal reflux disease, leukemia, cancers, menstrual problems, endometriosis, PCOS, behavioral problems, pain disorders, obesity, relationship conflicts, big way, PTSD, stress-related problems, depression, anxiety, OCDs, fear and phobias, trauma from death and loss, and many more. These are some of the cases I have treated, and I have many of them. Yeah, anxiety and depression is like almost 50% of my practice. Relationship problems, big time, and a lot of other diseases and all that, big time. I have a lot of clients with that. Remember, willingness, responding, and action. Okay, I'm just going to talk about this, and then we'll take up the. So what we are going to learn in these 2 days is steps and how to have freedom. The 6 steps of how to have freedom from diseases without any harmful side effects of the medicines, and learn in 30 minutes the step to transform into natural health in 3 hours. The one simple methodology to have freedom from diseases without medicines and with no side effects. And now this is all done during the workshop. You are learning because I am demonstrating how it is done on people who are there as participants. So actually people learn, and at the same time you also heal yourself, and you are 50% to accelerate cures by 50% or more, and anyone can learn it. A lot of self-awareness and hundreds of people who have learned it. Okay, and I will just give you the how much does it cost and all that, just in case you are interested, you can join it. Yeah, it's on the 22nd and 23rd, and the cost is $14,000 for this 2 days. But and otherwise on 22nd, on the last day, if you join, it's 9,500. But currently it is going for 7,000. That is 50% of the original fees, and you can pay up paying 500. And the GPay number is 98208. My number 00120. Okay, so 98208 is my number. You can always join in. Now, friends, I want to take up I want you to just go through this small thing. Okay. So how many of you really learned something today? Was it helpful? It was helpful. Great. Yeah.
Sure, sir, it's helpful.
Hey, Rina, it's you.
Rennie.
It's you.
Yeah.
Okay, great. So now I want you to close your eyes again. Focus on your breath. And now just observe, as you observe your breath, what's happening in your body, the bodily sensations. Do not analyze, do not try to change anything. Remember, you're doing perfectly well the way you're doing it. Just observe all the discomforting sensation, or there could be some comforting sensations also. Comfortable sensations. Do not analyze, do not change. And wherever you are, as you observe any discomforting sensation, just very quickly touch upon what is the memory coming up. Also observe the bodily sensations. Breathe in deep and breathe out. Just notice where all these sensations are traveling. And now breathe in deep and breathe out. Breathe in deep and breathe out. We're going to complete soon. Pay attention, bring it to your attention any good memory or many good memories when you felt very happy, joyful, or calm and relaxed, or peaceful. It could be an incident, a relationship, or today something happened. Breathe in deep and breathe out. Observe the sensations. Just observe, notice the sensation, let this sensation spread. Yeah. Now, open your eyes. Yes, friends. Tell me, how are you feeling? Can open up and shout. You can open your videos even. And tell me, how are you feeling now? Good, Kajal?
Very good. Very good.
Thank you.
Actually, these are the practices we are learning in tasso and hypnotherapy and all. And this was so quick. Only through breathing you can change your pattern. Like I could straight away connect to the back of my sacral, and it was moving so fast. And the moment you said to connect to the memory, I connected so well to my youth when I was 25, 26, and I needed attention. I was doing so many things to get that attention, but I always thought that I needed the attention of my husband. But now today it was revealed to me, no, it was not from him, it was from somewhere else I was needing, and I was not getting. The body needed that attention at the sacral back sacral.
Yes.
And I could release it nicely, you said, through breath. I'm doing all this very nicely otherwise also, but within 5 minutes, how can you
That's
do it? That I learned from you today.
That's
And
exactly what I'm
in
saying.
a
That
24 hours, you can go through this many times, and you can just keep on releasing.
so that's so beautifully said, Kajal. This is what I learned from someone who attended my workshop. Was there after she left my workshops, she said, Ajit, this is such a beautiful therapy because I was standing on a bus stop. That time it was on. I'm talking 5,
And
6.
you can go through,
And
yeah.
she says I was going through all the healing right there at the bus stop.
Yeah.
So this
And
is
your breath is able to make you reach there.
yes.
You
So
can
that is
reach
where,
to that part of body through your breath.
not just the breath, it's the way of connecting. So that is what I teach in
Yeah.
these 2 days of core somatic integration that is happening on 22nd, 23rd. Yeah, I would. Yeah, thanks for that, Kajal. Anyone else who
Thanks.
would like to ask or say? Thanks a lot. Yeah, Hemanji.
Yes, sir. Day before yesterday, I called you.
Yes, you called me.
So I had a heart attack on 4th January.
Yeah.
I am maintaining myself very good, but due to I think COVID, that blood get thin, and that happened. So is there therapy works for such a type of problems?
See, I can tell you therapy works because it has got a particular principle. It's got a particular flow. It doesn't matter what is the disease. It works. It is, I generally what I say is that we don't go by the name. The name is very important. Are you getting me? Like a heart attack versus high blood pressure versus headaches. These three are different things. So we might require some more time over here, and for this it is lesser time. So that is how it is. So for that, definitely we require the name of the disease, but the principle remains the same how we go about. So it can help a lot. Yeah, but it's individual also. So that's why I'm saying it can help. I will not say yes, it will help because I don't know you. We have not gone through it. Yes, but it does help. Hemanji.
Workshop is full time Saturday, Sunday.
It is 3 to 8 o'clock. Yeah, you can always join that also. That is also a very good way to start. People have been like, I have someone, she's not come here. She had developed cancer and she had learned this. And she said, Rajiv, I couldn't even stand up. I was so down and out, so tired all the time. And after doing the workshops, I started practicing every day. And now I realized where I am going wrong and all those things. At the same time, she started her own class of dancing where she teaches for 4 hours. Someone who couldn't even stand and was so tired. She's saying, I am so energetic. And my relationships, which was bad for last 10, 12, 15 years, it has just transformed magically. So her relationships changed, her disease has reduced, and of course, her career is moving up. So all those things have happened. Yeah, great. Thanks, Hemanji. और किसको पूछना है, कहना है? So whoever is interested can join the workshop. You can message me on 98208 00120 98208 00120. Yeah, and I will give you, and you can GPay on that, or you can just message and call me on that, and we can talk about it. Go ahead. Who wants to? Any questions?
Sir, can I?
Yes, Anita, please go ahead.
Sir, I have treated some of my friends and family, and good results came out. But sir, one thing, I'm not able to remove my headache today. When you when you ask for exercise, तो मुझे ना वही कान में हैमरिंग हो रहा है एंड हेड हैवी है. फिर थोड़ा आगे गए तो बैक तक आया, बट एंड गुड मेमोरीज में मुझे कोई मेमोरी नहीं आती है. लाइक मुझे अपने आप पे वर्क करना है सर, आपकी हेल्प चाहिए.
Yes. So Anija,
आई एम नॉट एबल टू रिमूव माय हेडेक सिंस 2 months. आई एम सफरिंग फ्रॉम.
yes. So Anita जी, क्या होता है ना, हमारा जो माइंड होता है ना, हम एक कोई चीज से आदी हो जाते हैं, चाहे वो सफरिंग भी हो, डिजीज भी हो, तो वो एक लेवल के आगे खुद नहीं जा पाता है. दैट्स व्हाई यू नीड सपोर्ट. कोई थेरेपिस्ट या कोई प्रोफेशनल होगा ना, उसकी जरूरत हमें पड़ती कभी है. क्योंकि देखो,
आई अंडरस्टैंड दैट कि मुझे आपकी हेल्प चाहिए. मैं बिल्कुल आगे जा नहीं पा रही हूँ उसमें.
तो हम लोग करेंगे.
आई एम ट्रीटिंग पर्सन्स बट नॉट एबल टू ट्रीट माई सेल्फ. दैट
Yeah. So Nibha, you are asking about the issue growing. Yeah. Nibha, where is Nibha? No. Okay. Thank you, Emanji. Okay. Sushil Patare. Any other questions anyone wants to ask? Daina, Gyandev. Gyandev ji, bolo.
Sir, now that we did this exercise, the one you just gave us, what I was experiencing was also like Anita ji also said that, like good memories. You said good memories के साथ कुछ तुम्हारे body में कुछ changes आ रहे हैं कि नहीं? Good memories के साथ ज़्यादा changes नहीं आते.
Yeah. So the reason I brought up the good memories is very simple. See, earlier what I used to do, I used to bring all those memories, and then I would just experience. But the thing is that there are some people who suffer after that, saying that हमारे को वो suffering बढ़ रहा है. So what I am doing now is bringing up the good memories, ताकि वो तुमने memories तो लाया, we can't heal it. So I bring up the good memories so that we can replace it, and then we can leave them there back in the original position till the time they go in for some healing work. That is the only reason I bring the good memories.
Okay.
Yeah, because नहीं तो क्या होता है, मैं छोड़ देता हूँ उनको, फिर वो बाद में सफर करते हैं. So we don't want that. Yeah, Anita, you can repeat the seminar. Yes, you can. Yeah. So
thank you. Thank you.
Yeah, please message me on the group. I will send it.
Yeah.
Okay. Anyone else? Any questions? Sushil, Rani?
So the one last question was the fundamentals of this therapy is that you pay attention to what your body is saying.
Yeah, that is just basic, but maybe there are various techniques and methodologies by which, like what Anita is saying, she is able to help people. But उसके अंदर भी एक टेक्निक होता है जिससे हम ट्रैकिंग कहते हैं, और उसके बाद सपोर्ट एंड मूवमेंट होता है. वो सब करना जरूरी है.
Correct.
Which I cannot bring it up over here because that can take 10 minutes, 15 minutes, 1 hour also.
Yeah.
Yeah, and also may take few sessions for some people. So Buthaina, yes, whatever you ask, it can be, yeah, to block heart arteries. Yes, we can definitely look into it. Huh? We can definitely look into it because we have had cases jahan pe other issues, they have healed themselves very well. Right? Because it's not about the calcified thing, it's something stuck up somewhere. Are you getting me? Something stuck up over a period of time. Are you getting me? Some kind of grief mostly. I don't know whether I'm right or no. Some kind of grief which
Yes.
has been stuck up for a long time, which or some kind of sadness which has got calcified. I don't know whether I'm right.
I've just sent you a personal message on your phone, so we'll connect that way as
Yes,
well.
please.
Thank you.
Yes, please, Bhutai. You are the one who's BUTHY? Okay. Chalo. Hina, Veena, Manoj, and Hemant ho gaya. Okay. So thanks. Yeah, Anita, you want to ask something?
No, sir, not ask. I want to share something.
Please go ahead.
Two cases, very surprisingly, no, one of my helper means when the voice, cracking voice of plastic coming, no, to plastic when टकराते हैं तो वो आवाज से उसको she was start crying, lot tears.
आप हिंदी में बोलो चलेगा. आप हिंदी में बोलो.
या फिर ओके उसको बहुत आंसू आते थे आंख में और हार्ट में जैसे गड्ढा हो रहा है वो होता था. And sir, within 15 minutes, and since years, 15 years, she was suffering from that. And within 15 minutes, with what I have learned from you, within 15 minutes, उसका आंखों से रोना बंद हो गया था. वो जब भी चरचर की आवाज आती है ना प्लास्टिक की, या उसके अपने आप आंखों में से पानी आता था और हार्ट में उसको बहुत फियर होता था. वो ठीक हो गई नहीं. And one of my friend, she is much more elder from me, उनको चलने में तकलीफ होती थी. फिर जब एक्सरे वगैरह सब निकाला, रिपोर्ट करी, एवरीथिंग फाइन. तो पर वो लंगड़ा के चलते थे सर. उनको भी 15 मिनट में एकदम बराबर चल लिए वो, ड्यू टू दिस सर.
I'm so happy. I'm so happy to hear that.
इतना और मोटिवेशन मिला. और आई एम फैन ऑफ यू सर. दिस कोर्स सोमेटिक, it is jadoo, it's a magic.
Thank you very much.
Yeah, thank you so much.
Thank you, dear. So, great. So thanks, Anita. And this is just one off, I'm telling you. Kajal, thank you. This is just one off. Yeah, and she's just learned it once, huh? And she had told me, Rajiv, I don't know how to do it, but she's been practicing. And because I think you did it some 3-4 months back, 6 months back.
Yes, sir. No, I think more than 6 months. But आपसे जब सीखा था उसी के अगले दिन मैंने एक पे अप्लाई किया सर. बहुत confident.
I remember you told me this. Yeah, Gyandev, this is the same workshop.
Yeah.
Gyandev, this is the same workshop.
Yeah, within these 2 days, what we have learned, superb. Yeah, sir.
Thank you.
Yeah.
Thank you.
मैंने पहले कभी नहीं सुना कहीं. वही हाँ, आपका एडवर्टाइजमेंट देखा था और फिर क्लास करी. That's all.
Thank you. You're in Hong Kong. Where are you?
Yes, sir.
In Hong Kong. Okay. Thanks, Anita. Great. Shala. Okay, friends. Thanks a lot for being here. Yeah. And I will be coming up with more webinars. This is a part of, like, if you are interested, please join the workshop. Even if you are not joining, perfectly okay, keep coming for the webinars. Yeah, these are all free webinars. So intention is definitely that you learn. But if you're not learning, Perfectly okay. Keep coming for the webinar. Kajal ji, you can take this up if you are already learning all this. Take this up. A lot of people who have done TASO and all that. I have been a hypnotherapy trainer, if you don't know. Yeah, and I've been with Eka for longest period, right from the time of inception. So if you're learning, you can definitely join it. It's going to help.
I want to learn. Actually, I'm very keen to learn. I'm open to learning only now in this part of my life.